Everyone.
There we go. We actually, that might be a spoke this week. We may be doing next week. Let's hope. So, good afternoon. Thank you for coming to this session. And we had the joy and the honor of having the after lunch session. So hopefully you're not going to be dozing off and taking your afternoon nap. But today we're going to be talking about water safety and how we can accelerate the progress of water safety with results-based funding. My name is Andrew Armstrong. I work with Uptime Global, and I'm joined by colleagues from Oxford University Reach. If you raise your hands maybe, and as well as colleagues from EOS International, from Safe Water Network, from Water Mission, and who else? FundiFix. We also have someone representing FundiFix here, but we'll get into those introductions later. The objective of today's session, if I could advance the slide. So what we're going to be doing today is exploring how results-based funding can address water safety issues in Africa, Asia, and Latin America across different types of rural water infrastructures and service delivery models. We're also hoping to give you all an opportunity to critique an approach that we are proposing. This is a brief outline of the agenda that we're going to be covering. We're first going to hear, I'm going to provide some background to what we're doing here, but then we're going to hear from Professor Katrina Charles from the University of Oxford around the approach. And we're going to invite our service provider partners up to comment on this approach and how it applies in their context. Then we're going to break up into small groups and really, I mean it, try to critique this approach, pick it apart, and then we're going to come back and have some next steps, talk about where we're taking this in the future. So a bit about Uptime Global. We were founded to address the rural water reliability problem. This chart here may be familiar to many of you, which estimates functionality rates, point functionality rates of rural hand pumps in Africa and Asia, around 30%. Everyone in the room knows that rural water functionality and reliability is a problem. But we also are addressing the underlying problem of that, which is financial viability. And we're doing that by applying research from colleagues at the University of Oxford through the REACH program around how results-based funding can incentivize and drive better performance in that space. Specifically, what we've done at Uptime is develop a series of key performance indicators. I'm going to use this pointer here. You can see here around reliability of water points, volume of water that's distributed, and local revenue that's generated from services. We apply a calculation. So the way this works is service providers deliver services, could be hand pump maintenance services or piped water service delivered to public standpipes or to kiosks or people's homes. Once they deliver those services, they report to Uptime. They report to Uptime on those results, and then we calculate a performance-based payment to them, and the service providers are paid in arrears for services that have already been delivered. Okay, I'm going to pause right here. I started early. I'm going to check to Catherine over here. Am I speaking loud enough into the microphone for,
I think for the recording, can everyone in the room say anything here?
You're good.
Okay, great. And I will also say to anyone who is joining us online, if you're just joining, please go ahead and introduce yourselves in the chat window. And if you have questions questions as we're going through this presentation, please make sure that you log those in the question and answer box so that we can address those during the breakout group time. Thanks. So that was a very brief overview of the Uptime funding model, which I'm sure many of you have lots of questions about that, and I'm happy to answer those questions around how we apply reliability performance indicators in our contracts. This figure here gives you an idea of the scale of where we are applying this approach as of this year. We are working with 13 service providers, now actually a few more as of the last couple of weeks. If you're a service provider working with us in the room, please raise your hand. Yeah, so look at the people that are raising their hands. And if you want to know more about how Uptime works, go find them during some of these breaks. And we also are supported by a healthy group of funders. And if you are a funder of Uptime in the room, please raise your hand. All right, wonderful. So you can go talk to some of those folks too to see how this applies. But we right now are working with 13 service providers that maintain roughly around 80,000 hand pumps and pipe to water points, serving about 4.5 million people. The headline from this that I want to point out is that on an annual basis, users are paying for these services over $3 million per year. And then the subsidies that we are providing to these service providers to keep that service going is less than $1 per person per year. The purpose of this session, though, is to talk about water safety, not as much the reliability of what we've been doing. We've been doing reliability contracts for the last 2 years. We've been working this year to conceptualize an approach around water safety and how that might be applied to our existing contract model. And we have published a working paper last month. You can pull up the QR code, or if you want to go to our website, you can download the working paper there. Everything that we are talking about today is described in this working paper. So if there's a key figure that you're looking at, and oh, I need to remember that, go to the working paper. And again, I would encourage you to go to the Uptime website. We have a slew of other working papers that outline our approach and how our funding model works. So without further ado, I'm going to introduce Professor Katrina Charles, who's going to come up and introduce this approach to us, how we've been thinking about water safety in the context of where Uptime works. Mr. Charles?
So what Andrew forgot to mention is we do have a few hard copies for those of you who like to carry heavy objects around. So there is a selection here at the front, but it's first in, first served. So firstly, as Andrew said, I'm Katrina Charles, and so it's been a real great opportunity to work with Uptime and the various service providers that Andrew has mentioned over the past year to look at how we bring water safety into the work that professional service providers do. And that by no means means they're not doing it. They're thinking about how do we standardize what they're doing across these different models and make sure that it's recognized. There've already been some really great sessions here at the conference around professionalizing rural water services and recognizing the different models that we see in rural service provision and the emerging trends. One question that came up very clearly in a session yesterday was around the issue of water safety. How do we bring water safety into rural areas? How do we make sure water safety plans are implemented for rural communities so that we're starting to address the water quality issues that we see in those areas? And this is what Saskia Nowitzki and I have been working on for the last, quite a long time now. It is how to advance these issues in rural areas, and so particularly working with FundiFix in Kenya for a number of years, and also establishing the safe planning model in Bangladesh with the government of Bangladesh. And so this report brings together a lot of those learnings, brings together learnings and from the partners here, Uptime partners here today, to really think about how can we advance rural water safety. And so a couple of key points before I get into the details of the report. I think the report proposes an approach to results-based funding contracts that incentivizes water safety planning, water safety actions in line with that water safety plan approach. It's designed to be appropriate across international context, so it's not based on one country's specific guidelines, but more looking at the WHO small water supply guidelines and how can we operationalize that. It is in line with water safety plans, so it's taking a risk-based approach to try to incentivize continuous improvement within for improving water safety, for advancing water safety. It doesn't require that professional service providers have it all right straight away, but recognizing an adaptive approach, we're trying to incentivize the actions that will continue to improve water safety and the learning that's needed for that. I think the last point, based on the discussions over the last few days, has been that it's focused on what are the data that we need for decision making. I think with those of us who are scientists, we love data. We'd always love to have more data. But it's looking at actually what's the frequency of data, what's the amount of data that the service providers can use and make decisions based on. And to make sure that we're getting the right value, making sure that the investment in data collection is proportional to what can be acted on. So with that, we'll go into the report a bit. I think one of the things recognized from the start is that water safety, particularly in rural water supplies, is not up to what we would hope it would be. It's not meeting the guidelines. We've got, this is data from the Joint Monitoring Program. And so what it's highlighting in these orange boxes is that water safety or big contamination in small water supplies is unacceptable. So roughly 50% in boreholes, which we would think of as a safe technology. In pipe systems, you're looking at a median of around 30%. Of populations, we're using those and using unsafe supplies. Protected wells and rainwater systems, not really different from unimproved systems. So our idea at the beginning of the Millennium Development Goals that these are providing safe water is not supported by the data. And this is just focusing on the microbial risk of fecal contamination. It's not even getting to the chemical risks as well. Okay, so there's even more issues, and with emerging, there's already been talk about emerging contaminants and all the other emerging risks that are around in water safety as well, that we need to start to think about. So to address this, what we need to do is think about how we manage these, because what's often been the challenge here is that the infrastructure is being put in and there's not the operation and maintenance. And so Uptime have done great work in terms of improving reliability, functionality of these systems, working with different service providers. For improving water safety, we also need that management. We need actions that providers take, or communities take, to improve that water. That's not necessarily treatment, but it can be about managing the catchment, making sure no one builds a latrine next to that borehole and so forth. We did a survey a couple of years back now where we talked to a lot of different service providers across the world. We got them to a fill-in survey to understand about their activities, and part of that was looking at water safety. And overall, almost uniformly, service providers are already doing some water safety activities, but they're not necessarily doing all of them, and there's no consistent approach. So we're talking to different service providers. They have made their own approaches to water safety and operationalize them, but there's a real opportunity to learn from different providers and also to incentivize behavior so that they're doing all different aspects of water safety management, from water point monitoring through source protection, water treatment where needed, and reporting results and sharing them. So what we're proposing in the report is a results-based framework for protected and reliable drinking supplies that builds on Uptime's work already on volume and revenue, reliable services, and then bringing in protection into that and water quality. And so this is based on four key principles aligned to water safety planning. So the first is around improving water safety. The idea that it's about the improving part of it. We recognize there's a really broad range of risks, a lot of challenges that are being faced, but the key to that is not just testing and understanding those risks, but there needs to be actions to manage that, to make that shift towards improving it, not just understanding it. And so within that, then, it's about incentivizing action. Taking it, as I said, beyond the test results, thinking about what happens next, making sure that there is a result from that. What we see too often in some of our research is that where we get a test result that is outside the guidelines, that the response is let's test it again. Let's see if we can get a better result. Rather than a second test, what we want to see is that actually someone's trying to change something. The third point is about learning through data. So this is the structure of this incentivizes the providers to better understand their systems and improve those water safety actions and take those water safety actions to reduce the risk. So it's looking at that continuous improvement approach that's embedded in a water safety planning approach. And it's also about sharing that data with different audiences so that they can learn through that as well, so that the communities can value the work that the providers are doing more, so that they know the water's safe, and so that governments and funders can understand the work, better understand and value the work and build confidence in the work that the service providers are doing. So the framework itself has, we said, risk-based domains applied to rural water management activities. So some of these, this is a much more simplified version of a water safety plan. Some of you may be familiar with a much more complex version, and one of the challenges that Uptime posed to us was, well, we need to make this appropriate for service providers. We need to make this fit with what they're already doing. And so what we've done is to simplify this into three domains. The first is assessed, looking at understanding the system. Second is reported, making sure that relevant authorities, community leadership are informed about water safety status. So it's not staying with the provider, but it's being shared and there's transparency in what they're doing. And as I said, that there's that shared learning as well. And then thirdly, the third one is about managed. And this is where we're looking at defining good water safety status. So whereas before we've talked about safe water, and that's a really difficult term because there's so much going on in terms of water quality risk. Is safe water no E. coli, or is safe water also no arsenic, no lead, and many other things? So what we've done for this is to define good water safety status as a way to operationalize this. The framework, and this, the writing here might be a bit low, but I'll talk you through it. And it is all in the report, as Andrew said, so do just download it. So we've got these three domains. So for assessed, what we're looking at is for providers to be, as I said, understanding their system. So the tools for that are sanitary inspection and water quality testing, both microbiological and chemical. And there are different frequencies set out in the document for hand pumps and for pipe water schemes. So looking at applying the WHO small supply guidelines to make sure it's appropriate for those different types of system. And they're different, and the testing frequencies are all outlined in there as well. In terms of what we're looking for good water safety status in the centre, the key thing is that there's a low risk sanitary inspection score. And this is not something we've been working with Safe Planning with for the last year or so, showing that service providers investing in, looking at their sanitary inspections and doing more repairs to water systems can readily get them into a low risk category. And in terms of water quality testing, for good water safety status, we've got no E. coli detected in the 100. So WHO recommendation in terms of fecal contamination. And so we're just focusing on microbial risk for that good water quality status, recognizing that that's the urgent risk, the most important one to deal with. Chemistry is there, chemistry is monitored, but it is not part of that good water safety status that we're looking for at this stage. The next step is reporting. So that's reporting to community leadership and to authorities. So again, sharing that data and making sure that's available, accessible to different people who need it and can help use it to inform strategy and policy, and also to help ensure the community knows what to do. One of the key parts of that is making sure, for example, that if E. coli is detected, that the community knows straight away that they can act and also help to manage the risks. The last part is on management. And so with management of the water system, we're looking at that actions have been taken if a risk has been detected, so the actions will respond to that risk to improve it, and there's another test. So it may be that good water safety status is achieved already and there's no further actions needed, but where there is a risk detected, that there is a management response. And I should mention too, the water quality monitoring does have some seasonality to it to reflect the issues associated with seasonality in that water quality. So just finally, in terms of how this is implemented, I think there are two types of payments associated with these. So there's a payment associated with assessment and reporting. So that service providers get paid just for doing that testing and telling people about it. So even if you can't achieve, say, quarter, there is recognition that you're trying, and there is an incentive payment. And then the second level is then managed. So if that good water safety status is achieved, if that whether those actions are taken where there is a negative result, and further tests to show that it's achieved, a management incentive is then provided. So this is based, as we said, on actions. So there are actions towards water safety. So I think that's the report that we wanted to share, and then I can pass back to Andrew, who will lead us through the time.
Here, one minute. I'm going to use this. Katrina did a wonderful job and finished 5 minutes early. So I think there may be a couple of questions. So we're going to manage this. Just to tell you what's happening next, we're going to bring some service providers up and talk through some of this stuff, how it is applied in their context. So this isn't the last you're hearing about this stuff. We're going to apply it. But if you have any questions for clarification right now, I think we have time for a couple. I've seen the bill saying, then I'll come back there.
Thanks. Just a very quick question. The incentives here, the payment, I understand two different payments, one for the assessment and one is triggered if there's an action taken. Are these like negotiated rates based on the cost? I mean, how do you determine the payment? And if you have two operators in one country, do they get the same incentives or depending on their cost structure and how you help them to recover their operational costs? Thank you.
Yeah.
So I can start to answer that, but I'll hand back to Andrew. So certainly, I mean, the management incentive can be achieved if the system's already at good water status. So whether there are actions needed or not for that. But if there is an action, it's not yet at, or if there's a problem detected, so for example, E. coli detected, there needs to be an action and demonstrate that action has worked, and so there's that learning embedded in it. And then in terms of how we set those numbers, I'll pass to Andrew in a moment, but I think one of the key things is that we are over the next year or several months, we'll be highlighting this with different providers so that we can see better understanding of what are those differences in these different contexts, because we know we have some providers who are working with established infrastructure, so they're taking on infrastructure that's already established and that has its own set of risks associated with it. Others are setting up their infrastructure from scratch and have much more control over the chemistry and whatever and microbiology of those systems. And so that's been recognized in developing this, and we continue to recognize that as the funding structure is developed.
Sure. And I'll just say, thanks, Nabil. The short answer is we don't know what these payments are going to look like yet. But part of what we have done on the reliability payment side is come up with a very simple, easy to remember, easy to explain structure that I encourage you to go look at our working paper and read how that goes. We're trying to do something very similar with the water safety payments. We don't know yet if we can apply the same payment levels across all the service providers. Right now, we have two different types of payments, one for hand pumps, one for pipe schemes, volumetric pipe schemes. We'd love to have a similar kind of thing on this level, but we're also, all the service providers in the room are giving us input into what these payment levels will be, and that's how we've designed our original contract structure. So we're gonna do the same thing with this. Thanks. One more question back here.
We have some experience from Nepal. Positive plan is how the system was implemented since 2006. Many years back, almost 3,000, more than 3,000 water safety plan in rural area we already implemented. Not only water safety plan, that is the auditing is going on, impact assessment is going on, and on top of that, the quality surveillance also linked with that. Yeah, in spite of that, the water quality is not improved. The SDG target 6.1 is not only off track, it's going down. That's why Nepal government, we do the joint sector review and national water quality workshop, we have decided chlorination as the disinfection should be the entry point. Not talking about the big things, let's try chlorination as the entry point and it should go as the national movement. And the chlorination should be scientific, yeah. That means monitoring the residual chlorine and reporting regularly. And for that, we don't need any big laboratory, just small water test kit will be good enough. This is our plan. Any solution for Nepal? Thank you.
We do work with Nepal with colleagues at Helvetas Network who are working, and we've learned very much from their experience as well. So one of the things that is part of this approach is thinking about how do you make data available for decision makers. And so part of that has been our work looking at fit for purpose laboratories. So making laboratories where we have service providers who have their own laboratories, where they're focusing on, so they can do their own E. coli testing and get their results the next day. And that's something we've done in Nepal, as well as making sure that data is available. I agree with you that chlorine is absolutely a key and important way to go. And I think a lot of our service providers who will come up in a moment will share their experiences of chlorination and how they're doing it in their different systems. And I think that's something that we are finding that lots of providers are finding is a good solution, a good way to improve the water safety in their supplies. But it's always context dependent, whether there's a supply chain, whether there is community acceptance of that. And our experience of safe planning has been getting that data to decision makers has helped to challenge some of their preconceived assumptions, where they think maybe we don't need chlorine. It has been really helpful in sharing with government and seeing that. I think we've seen we're aware of what Nepal's doing, and there's some great work going on there as well. So hopefully, yes, it'd be great to talk further about how these might align once you've heard a bit more about the different service provision models.
Thank you for those questions. Hopefully we'll have time after the breakout group for more Q&A. I'd like to invite the service providers up to the front. And while you're coming up, I will introduce you to everybody in the room. Okay, so also to clarify, all of these partners who are our service providers who are seated in front of you, you'll be hearing from over the next couple of minutes, are contracted partners of Uptime. So they're already receiving funding from Uptime on the reliability side, and they've been selected to help us pilot this approach on the water safety side in the coming year. So who we aren't seated in order, but I'll go from left to right. Okay, first we have Saskia Navicki, who is a postdoc core researcher at the University of Oxford. She's been involved in the FundiFix, in the development of the FundiFix model, which is a hand pump maintenance company in Kenya. She's representing our colleagues from FundiFix today who are unable to be here. We also have Charles Ribola, who's from Safe Water Network in Ghana. We have Laura Lambert, who is from Water Mission, representing their programs in Honduras and Indonesia. We have Megan Lindmark, who is from EOS International. EOS International, if you pronounce it in Espanol, and Internacional, okay. And Megan is talking about their work specifically in Honduras today. And then last but not least, who you've already heard from, is Professor Katrina Charles, who is representing Haisawa and this program that you've heard us talk about called Safe Pani in Bangladesh, which is a model that is applied through the government of Bangladesh. I'm going to explain more about what that looks like. Okay, so my first question, this is not a panel discussion because it's preconceived questions, but we're going to kind of move through this to give you guys some perspective. My first question is, we're going to go down the row here and summarize your service delivery models, okay, and how reporting, please summarize how water safety assessment, reporting, and management applies in your context. So that's what we've given each of these folks 2 minutes to talk about this. We have summarized this information in a table that you can snap a photo of and come back to later, but they're going to be basically talking you through the information that's in this table. So Saskia, can you please start us off? talking about FundiFix and how water safety assessment, reporting, and management looks like in their model.
Thanks, Andrew, and hi, everybody. I hope you can hear me all right. So yeah, as Andrew said, I'm here to represent FundiFix, Cliff Niaga, and Jacob Kutuba, who are the directors of FundiFix. Unfortunately, we're not able to join us. But the FundiFix is a professionalized service provider. It's a charity trust setup model. They operate in Kitui and Kwale counties in Kenya, serving schemes that provide water to about 70,000 people is the current estimate. And they've been doing water safety, starting their focus on water safety with water quality monitoring program that they initiated around in 2018, and have focused on monitoring microbial safety through E. coli and physical chemical sampling as well. So they've done baseline trace element sort of full suite chemistry testing that's been sent out to external labs as they onboard schemes. And then they did some fluoride monitoring as well with and selective electrode probe in-house. So they have a combined approach of using fit for purpose lab that they're running at their head office, and then also sending samples out where needed. They report the results of this to the community-based water managers for the schemes that they're maintaining, and also report to the local government and to the sort of sub-county and county level government water offices. And then in terms of management action, so this is something that's being driven largely by the results of the testing. They have a combined approach. So part of it is communicating with communities around the sanitary inspection results, what kind of actions can be taken for better source protection. Sometimes it's infrastructure uplift activities, and that can be rapid where it's things that can be quickly fixed, and sometimes it's slower where they need to source additional funding to do larger upgrades. And then they've also started implementing chlorination across many of the small pipe schemes that they manage. So I think that's.
Thank you, Saskia. Charles, I'm going to hand the microphone to you. And also, if anyone wants to come, there's some other chairs here if you would like to sit. Okay. Great. So Charles, please. Yes.
Thank you. I think in our context, we primarily work within the Ghana scope. And in Ghana, we work out of the 16 regions. Our footprint is about 10 out of these 16 regions. We primarily construct and manage off-grid micro utilities through public standpipes, and also increasingly currently through direct household connections, serving the last mile populations. In terms of the management, I think we look at what the source water potential is and where the potential risks are, and then we design the appropriate technologies to really disinfect this water. But I think for our gold standard is chlorination to achieve that residual barrier at the household level. So that's what we do. And then on daily basis, we actually monitor this at each of these systems. And then we report that through a digital operating system for us to review and then also feedback whatever is happening at the local level. We have an in-house lab that does monthly microbial testing, as more like a quality assurance on top of what we do at the community level. And then we also work with the certified labs. In the past, we had to work with the certified labs once a month, but increasingly as we expanded, it became more, difficult to really bring the samples from these hinterlands, the hard to reach areas. So we decided to, and it also becoming more expensive. So we decided to set up an internal lab to provide that ongoing support to technical services. And then once a month, we do a validation of some sorts with the, once a quarter, we do that with the certified labs. In terms of the physical chemical, we do that annually. Actually, we do that initially when we get the water source to really identify what kind of contamination we are dealing with. And then on annual basis, we do more like a tracking to see whether these parameters are changing or not. In terms of the reporting, it's actually to the community level, so every system, once the results are ready, we actually display that at the water station. So anybody who walks up would see the results of that. And then on annual basis, we summarize this. So we don't really give the physical reports to the government authority, but we summarize within our annual reports that we share with the district assemblies. And finally, it's like I mentioned, it's about chlorination. And then when we find that there are any potential risks, we design the corrective action plans to really mitigate, and then retest to ensure that we achieve some high level of national compliance with drinking water safety. So that's a summary of our operations and how we reflect our drinking water quality at the field implementation level.
Thank you, Charles. Well done. In those 2 minutes. Perfect. So now it's on to Laura Lambert from Water Mission.
Yes, good day, everybody. And I have a question. I was wondering if this water has been assessed and reported.
Cannot say.
Good, excellent. I'm representing Water Mission today, and we work across the globe, across East Africa, Southeast Asia, and Latin America. But today, specifically, wanting to talk to you about our work in Honduras and Indonesia with water safety. And so, Water Mission, we are an implementing organization, so we'll often come in and develop new infrastructure when it comes to water treatment and water supply. But we can also we also work with post-implementation support as well with that infrastructure. Our primary model is really direct support to a community managed, model of operating and managing that system. That might be infrastructure management or financial management. And so we're able to come in and either build new capacity in that community, if it's a new water board that we're setting up and building that capacity, or maybe we're taking an existing water board and building that capacity for a more advanced technical water treatment system. And so in our experience, when we've looked at water quality of groundwater, even in protected wells, we found that a significant amount of groundwater is contaminated. And so from day one for Water Mission, it's always been about water quality testing and water quality treatment in the water that we're providing. And so we'll look at surface water, we'll look at developing new water sources, to ensure that water is safe at the point of consumption as well. And so we'll customize our water treatment systems based on the results of those early water quality testing. And then we work with the community to really build that capacity to manage that ongoing. And so when it comes to more advanced technology, Water Mission can provide that capital investment, and then we're working with the communities to ensure safety ongoing. And so some of our reporting that we're doing or assessing, we're essentially doing, post distribution treatment. So that's with chlorine. So we're really building that capacity of committees to test for residual chlorine on a daily basis. And then Water Mission will come often on a monthly basis or quarterly basis and look at verifying that by doing, a much larger water quality testing. We'll look at other parameters, not just microbial, but we'll look at chemical as well. And often then reporting that back to committees and then back to local governments. And really in Honduras and Indonesia, we're essentially registered as a social organization. So we're not required by the ministries of health to report routinely, but we often get audited by those ministries of health on an annual basis as well. And the other thing about Indonesia, and Honduras, in Honduras, we started out doing more of like kiosk style and water delivery to households, but now looking at working more at the municipal level. So doing large scale municipal water treatment and water supply directly into the household. Whereas in Indonesia, you're developing new infrastructure and then being able to deliver that to the households as well.
Thanks, Laura. Now we're going to hear from Megan from EOS International.
Awesome. So our model, we operate in 3 countries in Central America, and we operate a circuit rider post-construction support model for pipe schemes. So what this looks like is we're operating in pipe schemes that usually already exist, and we're helping local community water boards install passive chlorination systems in order to treat that water. And then we're providing ongoing support to the community water boards through capacity building, through trainings, through technical assistance visits, and also through monthly monitoring. And so what does this look like exactly? So the monthly monitoring that we're offering is chlorination. So we're offering chlorine residual monitoring to the community on a monthly basis. And those results are then reported immediately to those community water boards in order to advise any kind of management choices that they should be making based on the results of those chlorine. So if there's not enough chlorine, we're recommending changes in the chlorination regime, et cetera. And I should also know, and I can get into this further later on in a later question, but we support these efforts that we're doing through chlorine sales to these communities that we're operating in. In addition to that monthly chlorine monitoring, we're also doing a full suite of physical, chemical parameters, as well as microbial E. coli monitoring. That happens biannually, and all of that is based off of local standards, so local Honduras requirements for reporting. The community water boards themselves are mandated to report these results to the government. So we perform these tests at our locally certified lab in-house, and then we report these results again back to the community, but also upwards to the government as is required. And then we're available to make any kind of management support decisions for the community water boards. So depending on the results, our local staff is able to explain the results, explain what the management choices that might need to be made, depending on the parameters that are in exceedance, whether that be bacterial or whether that be physical and chemical. And then we're able to provide ongoing support and follow-up monitoring as is needed.
Thanks, Megan. And we'll hand it over to Katrina.
Thanks. So the Safe Pani model is one that we developed with the government of Bangladesh and UNICEF. And we've been implementing it with a local NGO, Highsour, as the service provider. And so it's working specifically in schools and healthcare facilities in rural Khulna and the coastal area of Bangladesh. And it's taking on existing infrastructure, not building new infrastructure, and then providing operation maintenance and safety support for those. I think a couple of key things on here. So it's working with hand pumps, rainwater harvesting tanks, and pipe schemes, as well as some other technology. So it encompasses all the technology in that supply area in those schools and healthcare facilities. It's using certified labs for the chemistry, but in-house labs for the E. coli. And so the chemistry includes arsenic, manganese, and electrical conductivity and chloride as well. And that's, as we go to scale with that, it's looking at every 5 years for the chemistry, and then biannually for E. coli. And the reporting mechanisms are to the manager of the water system, as well as UNICEF, DPHE, and a steering committee who's made up of government across different ministries. And responses in Bangladesh include things like shock chlorination, but a lot of work in terms of improving the sanitary inspection scores, managing the hygiene of the catchments for rainwater harvesting, and thinking about improving the plinths for hand pumps and so forth.
Thanks, Katrina. I think everyone can see is we've heard over the last several minutes, there's a variety of approaches being applied. There's a lot of work being done, right? And so what we're trying to do is how can we package up all these activities in a way that makes sense and can be incentivized. We're going to have one more round of questions for our folks up here before we go to breakout groups. And so it's a specific question for each service provider. So the first one that I'm going to direct to is Charles. Yeah, so we've talked, Katrina, we heard Katrina talk about earlier that we took a risk-based approach for this framework instead of an outcome-based approach. And I know this is something that Safe Water Network has thought a lot about. So how does Safe Water Network's water safety activities in Ghana reflect a risk-based approach as opposed to an outcome approach, and why is that important to you?
Okay, thank you. I think for us, we look at the entire spectrum of service provision, right? So we have like a term which we always like talk about, even when we are designing, that we want to ensure that we provide safe drinking water from source to sip, right? So we look at the entire spectrum and see where the touch points are for potential risks, and then be able to mitigate. For instance, if we are doing it as part of our community selection criteria, source water potential and source water quality is one of the biggest things that we look at. If we see contaminants and we have the ability to really intervene, we would invest in such communities. But I mean, we talked about arsenic and manganese and other things. For instance, fluoride and arsenic, we just hit one community that we are constrained with such a community. And because we don't have the solution now that gives you the best, I would say, cost-effective way of managing that, we're still grappling with what we do with such a community. So we don't also want to really invest and then ensure that at the end of the day, people are not getting wholesome water. So even when it comes to source selection and site selection, this is a key thing that we actually look at to really ensure that we're able to more or less mitigate whatever risks that are in there. So if we are citing, if if there are potential risks for maybe some sanitary facilities in that area, we're able to like avoid that and be able to make sure that at least the source that is coming in is of some high level of quality that you need minimal intervention to really disinfect and save. And then through even the distribution and the treatment, we also look at the appropriate technology to be able to do that. Along the water lake, for instance, we employ like slow sand filtration to really do our first level of disinfection. In areas where we have chemical contamination, for instance, we also look at if we have like ion exchange to do that and all that. So every point that we find any risk, we're able to really mitigate. And I think increasingly, if you even look at distribution and the last mile connections, we're also looking at increasingly our distribution and how we can even maintain water quality at the point of use at the household level, because we are actually investing in infrastructure to really send water directly to homes in line with the SDG 6.1. That raises the bar in terms of our responsibility to really ensure that what the consumers are actually ingesting is of the highest quality. So we are looking at all these parameters and ensure that at every point in time we're able to intervene. And I think that the risk-based approach actually gives us the flexibility to be able to really look at what needs to be done and also monitor on an ongoing basis. If there are some changes in the parameters, you should be able to now identify that and then be able to mitigate and ensure that we manage the water at a point where it is safe for people to use. And I think increasingly, like we discussed, this framework even gives us some additional responsibility to be thinking about. Yesterday we were having a conversation around sanitary inspections, which we don't necessarily do as we speak. But it's important that as we look at all these things and water safety planning, working with our partners and all that, new and additional protocols that are really key in ensuring that overall we're able to maintain water quality at the point of use, we are very open to doing that. So we believe that this approach is very adaptive. We believe that it's something that we can really, adapt to in sending water, safe drinking water to the point of use. So yes, with all the certified labs and all that, I think there's so many things that we are doing right, but also there's so many opportunities for us to be able to learn. And we believe that a program like this and being part of that gives us, even builds our own internal capacity to be able to manage water quality through to the point of use at the household level.
Great, thank you, Charles. My next question goes to Megan at EOS. And it has to do with EOS's model, specifically how their model allows them to work at a pretty substantial scale. So Megan, can you please talk to us how EOS's unique model of chlorine sales paired with a circuit rider in Honduras is able to allow EOS to work at a considerable scale? What are the benefits and what are the limitations of that approach? Yeah, and I'm also going to ask all the respondents to please try to keep responses to like a minute.
Okay, yeah, you bet. So I'm gonna in a minute try to touch on two pieces here. So the first, as Andrew mentioned, is chlorine sales. So the purpose of these chlorine sales is twofold. The first is to ensure that there's an active supply chain of chlorine around the communities that we're working in and that require this chlorine for water treatment, and ensure that a high quality supply is available. But the second is that it allows us to financially support parts of our circuit model. So in addition to traditional grant funding, as well as results-based funding, we also can pay for some of the services we're providing through those chlorine sales to the communities in which we're serving. And then the amount of communities that our circuit riders can support on a monthly basis can ultimately change depending on the maturity of that community in our model. So we can go from supporting maybe 50 communities with one circuit rider over the course of 2 years to ultimately scaling to serving as many as 100 or 200 communities with one circuit rider by the end of year 3. And so this allows us to simultaneously be reaching more communities, but also be continuing to sell that chlorine to continue to reach more and more communities. And I should say that this has allowed us to operate at a scale of close to 2,000 communities across Central America. And the second piece I want to touch on really quickly, hopefully if I have time, is that we're also operating in communities that already have piped schemes and already have legally recognized community water boards. So we are operating as a service to those community water boards rather than managing the infrastructure ourselves. So we're supporting the water boards who are doing the infrastructure management. And so then that gets at kind of the limitations that I think you're talking about, Andrew, in the sense that we don't necessarily ourselves repair tanks or provide repairs to the actual pipe distribution system. We're simply almost a consultant to the community water board as these emergent issues come up. We are able to advise them on how they might resolve some of these issues that require our technical expertise. And so, in a simple case, this might mean that in a failed chlorine test, we're able to provide advising on what kind of dosing they might need to do instead, or ensuring that they're actually replacing chlorine tablets in the chlorinator. But in a more extreme case, when, for example, a tank has a leak, we can only advise the community water board on how to repair that leak, but we ultimately are not directly responsible for the repair of that leak.
Thanks, Megan. So there's some interesting points there that we've really tried to consider in this approach. And if you have more questions about that, find EOS or Megan or Wes later and ask them about how that applies. My next question is for Satya. And this one is something that may be on the forefront of many of your minds. FundiFix is the only partner that we have in this pilot project that maintains hand pumps and pipe schemes. And so Saskia, my question is, how does FundiFix consider the differences in this water safety approach when they look at different types of infrastructures for hand pumps and for pipe schemes?
Thanks, Andrew. Yeah, so as Andrew said, FundiFix works with hand pumps and pipe schemes. And then within those two broad categories, there's a whole diversity of different considerations for the different source types that they're working with. They approach all of them with a kind of bespoke sanitary inspection setup. So using the World Health Organization sanitary inspection guidance that's come out more recently, where it's kind of tailored to your different type of infrastructure. But I would say it's also really working with the strength of FundiFix, which is that they have these long-term relationships in the communities that they're working in with these water systems. So they understand them really well. They understand where there are different considerations around seasonality. For some of these systems, people are only using it during parts of the year, and this has to do with the salinity of the water and alternative sources and things we're all aware of. So that's something they have to take into consideration when they're thinking about when the safety is more of a safety management is more of a priority versus not. The other big consideration for them is some of their schemes they're managing in the entirety, and others it's more of a hybrid approach where they're supporting community-based management as well. And so that factors in. So yes, the hand pump and the pipe scheme difference is important, but there's all of these other things that they're considering as well. And I think that this is where the flexibility of this kind of results-based funding approach really appeals for the FundiFix team, because it allows for those strengths and this sort of deep contextual knowledge that they have. It allows them to make the judgment of what's the best way to respond to risks when they're identified, rather than sort of applying a very one-size-fits-all approach. And so they're using, a range of, at the moment, they're implementing 4 different chlorination devices that match their different scheme types in different ways. In some cases they have some pre-filtration, in other cases they don't. So it's just a very sort of bespoke setup that they're able to maintain.
Okay, thank you. That sounds good. My next question is for Laura, and this is getting around the use of different types of labs in different countries. So how does Water Mission utilize both in-house testing and also certified labs in Honduras and Indonesia?
So when we started this work probably 20 years ago, there was not a whole lot of options in some of the very rural areas that we worked in. We made the decision very early on that we were going to build that capacity in-house for water quality testing. And so essentially, you can go to any one of our countries and find within each of our offices, a full laboratory to do a wide range of water quality testing in those offices. And essentially, that requires significant amount of investment in training staff. It's effective training of staff, and also creating a very robust supply chain of supplies. But I think for us, it was important that anybody and everybody that's working on Water Mission could essentially do water quality testing. So if you were HR, you should be able to know how to do a microbial test. You should be able to know how to do a turbidity test. But essentially we made that decision to really centralize that with Water Mission in the countries. But now, as things have changed and the landscape has changed, and there's a significant amount of really professional laboratories that are certified in the countries that we work, we are able to utilize them. So if something is comes back really high when we've done our own testing, then we can send that on for a more to verify our own results essentially. Or maybe if a donor or if there's regulation that requires a third-party verification, then we're able to do that. So we're in that process now of also trying to build that capacity in the countries where we work, and really try to strengthen even the water quality system and testing system to ensure that laboratories are meeting those testing standards as well. But it was critical for us to not decentralize that from Water Mission, but really ensure that something that was our key performance indicator was within our control to monitor.
Thanks, Laura. The last question here before we go to breakout groups is for Katrina. And I'd like for you to maybe speak to the process of developing this kind of approach with the government of Bangladesh. So the Safe Penny approach is a government-led program developed with Reach at University of Oxford. So for others who might be trying to think through a similar kind of process, what advice do you have and what pitfalls might be avoided with developing government models for water safety, results-based funding for water safety?
Thanks. I think with Safe Penny, some of the things we found, leadership and political will was really important. So we had engagement at high levels and across multiple ministries, because we were working in schools and healthcare facilities. We needed both that engagement in the water side as well as the healthcare and the schools. So we've got lots of government involved and at multiple levels. And so having that high level engagement meant that we could sustain it when we've had changes in personnel in different ministries and dealing with that. The other one is setting clear roles and responsibilities at the start. Before we took any test results, we had a clear agreement with the government. What should the service provider do? What were the accepted actions? When should they act? What were their responsibilities and what was the government's? And so for us, the chemistry is the government's responsibility. Microbiology is the service provider's responsibility. And the last one was that sharing of data, that we have that sharing of data. And that's been something that we've really been useful in building trust between the government and service provider, and also thinking about how we might make change and looking at some of those systems, because it's not easy to make change when it comes to chemistry. Bangladesh has lots of challenges in that area, but so thinking, being able to aggregate that data and share it with them has been really important.
Thank you, Katrina. So hopefully some of these responses have at least given you time to think through how this approach kind of applies in different contexts. We're going to move into breakout session. There's a couple of things going on. One is we're a little bit behind time, but also we have a full house. And so it's going to be difficult to move around. So what we wanted to be able to do was to let you all vote with your feet and go to a room, go to a breakout group. But we're not going to really be able to do that. And so instead, what we're going to do is ask our facilitators to move to different areas. And we're just going to sort of like have them stand next to 3 rows, okay? So how we're going to do that? So you're going to be assigned to a group, okay? But I think it's really important that we spend about 10 minutes getting kind of feedback on different aspects of this approach from everyone, all the experts who are in the room. So what I'm going to ask is that Katrina, you go to this first little corner right here. So like 3 rows right here, 3 or 4 rows. And what you're going to be talking about is assessing chemical risks. Okay. So the first 3, 4 rows right here. I'm going to ask Charles for you to go to the back corner. And so it's going to be a ambiguous line here between Katrina's group and Charles's group. But Charles will be in the back corner, and anyone who wants to kind of talk about microbiological risks, please turn around and kind of talk to Charles, okay? And Megan, you're going to go to the back corner over here, and you're going to be talking about complying with national standards and regulations. So if that's something that interests you, turn around and talk with Megan. Saskia, I want you to kind of stand in the middle here where TJ is, like raise your hand, TJ. And if what Saskia is going to be leading a discussion on is reporting results with communities and with authorities. And then Laura, I'd like for you to come up here to the front corner and talk. What Laura's going to be talking more about is incentive levels, okay? And it's fine. I see lots of people leaving. That's perfectly okay. I get that. But before we start talking, hey everyone, we're going to take 10 minutes, and I'm going to call us back. Okay, 10 minutes. All right.
Y'all are really popular.
I noticed how nobody followed my instructions and stayed in the seats. It's difficult for me to corral you all.
They say follow your dreams.
Yeah.
So our question to be around action. But if you kind of that all. My first question would be, we need to think about incentivize academic, that's why it's very different. It's one question. If we don't have no it's a public stage. Right, that one. You matter what negative. And most run out and what
How are the results measured? Is it volumetric? Is it, by other people that are tapped into the system? Or is this result basically more quality?
Yeah.
Right, as opposed to existing.
Right. And so this is not just, yeah, what kind of questions do you have around incentivizing things that and water.
What if you're talking about what would be the impact? Who's on
Groups that might not be doing much of this, how do we design things to encourage them to do something else?
Could it be a to actually over the hurdles for.
Doesn't mean it's not.
The other question.
I came in a little bit late, and I can't quite hear the background noise, so sorry if anybody else did. I was wondering about like the kind of sanitary inspectors report. Some things are within the control of an operator, or something not involved, some things community does, whatever, it's not fully in control. So I wondered if there's an incentive to get a good sanitary school. How do they deal with that kind of thing? And then I guess the second question is around that constant risk of storing your own exam papers, not doing your own tests. But there'll be a vested interest potentially.
And there is, they mentioned that they'll be using the, WHO sanitary inspection
right? And essentially, I don't know the threshold yet, but essentially if the score is high, then there's no and it's low, because so what is that threshold? The service provider control, it's not.
Yeah.
Consideration.
It's tough one, right? Bills, so nearby.
In terms of like scoring your own test, I mean, I think Uptime has also started to implement, annual audits of the data that it's being committed, and that's not just finding records, firsthand as well. I'm sure that there's ways, probably taking into consideration how you verify like this, which is something that's specified.
Well, how we don't
The speed of response. So one point, the problem. Similar to the downtime, the speed of trying to clear the downtime. How's it gonna set up a fast reaction? Or faster.
So for example, if like E. coli is detected, how quickly are you responding to?
Because that's one of the challenges, if you have to send your stuff off to the lab. You're at the mercy of the lab to give the information back, which can take who knows how long. That's.
The recommendation for microbiology risks. Somehow we're gonna, but we recognize that it's
And there are also various types of testing to be done, so maybe even if it could be presence absence, we can cut down the time significantly before going into a lab.
That would be a
Suggestion. Well, let's move into the next question then, I guess. So what are some of the strengths? Or the weaknesses? I think we've touched on maybe some of, at least one weakness. What are some of the biggest strengths and weaknesses of incentivizing service providers through?
Hello, folks, we're about halfway through the discussion time, it's the time check.
The latest one.
This one. It took some time, but I read it. It's, I'm a practitioner, we're a part of it, it's the best in that position. I've seen it like 50 years. And it's, I know, I want to take it's not, like realistic or safe, and you know, it's really positive things.
And I think one of the things that I went back to forth on was, let's not incentivize results, but incentivize like the process, right? So you're not rewarding the output, but you're rewarding like what effort was taken into that. And I think that's very much
Sort of like an ISO certificate, like where you get certified for a process that increases the likelihood that you're gonna have a safe and quality product rather than trying to test every product.
Yeah, so a little bit of a myth, if you don't respond, then you also aren't getting funding, but the flow chart, because I also had the time to read it, the flow chart is extremely helpful. I just think about the simplicity of how that is laid out. And when I look at the frequency of I tried to design that for different size systems and whose standards do you abide by, and I felt like this was incredibly recent. Like it was the frequency of testing. I don't remember what it is off the top of my head, but there was a frequency of testing laid out. Kind of like to think of the it was reasonable. It was reasonable. It was something that I felt like is a good standard to be putting out there, but it wasn't saying here's the move, right? It was I don't know. It seems very.
And to your point about the results, that's almost like the bonus payment, right? So when you like, you're getting most of your funding for doing the process, but if your results are, within what we want them to be, then you're getting the bonus payment. So it's
There's some sort of quality certification that would enable the water service providers, because they think certified by XYZ, and that should make you happier as a consumer.
Service that's like labs
Okay, folks, I would encourage you to have one more comment in your groups, and then we're gonna come back together.
I think one of the limitations of professional laboratory is it's not cost effective for them to do the quality testing. But if you're essentially maybe coming up with the agreement, which can say, hey, we can guarantee you business with this many. Then maybe maybe it's become a viable. So any suggestions that you have for time in terms of how do we incentivize the
All right, folks. I don't have a bell to ding here. I can find one on my phone, but ding, 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 ding. It's time.
I'm fine, one of us.
It's time. Thank you all. If I can get everyone's attention, we're not gonna rearrange seats, so you can stay in your seat, but if you need to turn your seat so that you can see, yeah, Keith, if you want to move, so you're not. Sorry. Just kind of turn your attention this way, okay? Thank you all. I know sometimes breakout groups are often seen as something like, oh, I roll my eyes, I don't want to go talk to people, but we really wanted to get feedback from people, and we were stuck with this group, so that's what we had to do. Okay, so what we're gonna do is move around the groups, and just get a brief report back of the key ideas. Any questions, learning questions or main suggestions, and see if there's any sort of consolidation around these different aspects of the approach. So I'm gonna start, even though Laura's texting on her phone, I'm gonna start with Laura. Laura, can you sit up and give us maybe, Jeff, what's that? You can't hear? Oh, you can't hear me?
Yeah, no, there's just a lot of background noise.
Okay, I'm like loud in my ears up here. So what we're gonna do, Tiara, can I ask you and Katrina to, quiet down for a minute. What we're gonna thank you, politely. So what we're gonna do is we're just gonna go around the groups and share in 1 or 2 minutes the key ideas. Any main questions? Really what we're looking for is a critique of this approach. What are the holes? What are the questions that you have if you were going to apply this? And we'll see if there's any consolidation. Then we'll have a couple of minutes to respond to some of that, and we'll talk about next steps. That's what's happening in the next 20 minutes. Okay. So Laura, can you please, what you guys talk about?
Right. So we were talking about how do we incentivize action with results-based payments. And so some of the questions that kept coming up were, are they negative side effects with these payments? Does it create this need for subsidies, ongoing? How are results going to be quantified? What is the level of subsidy that's needed? For one of the big questions came up, you heard from everybody that was here, we're already doing some sort of water quality testing and water quality monitoring. So what is the incentive for, us as service providers that are already doing it to maybe become more rigorous in our assessing and reporting and managing to be able to get further subsidies. So there's questions around that. And then also just the speed of the response of the data. So what do you do if, how quickly do you respond? So for example, the first contract with Uptime was about reliability. So you've got to respond to downtime within a certain period of time. Well, how do you respond to water quality data within an appropriate amount of time, especially if you're working with laboratories or decentralizing, your water quality testing? If a lab only gets your results back a week from now, if that's even feasible, then, what is really the speed of response that you're accountable to when you're working with outside stakeholders as well? Some of the strengths that came from it, one of the other service providers that's part of Uptime but not part of this contract is they're saying that, hey, in the 15 years that they've been in the sector, this is the most simple, most effective and realistic way to improve water quality safety. And because you're incentivizing the process rather than incentivizing the results, we all know how to play the game, and you know how to work the results sometimes, but this incentivizes the process and eliminates all the other variables that might affect your results as well. And obviously there's a bonus if your results are good quality. And then, this question of suggestions, could there be some sort of stamp of approval if you're certified by, X, Y, or Z, does your product then become something that customers or consumers would want to purchase because now you maybe have this stamp of approval? And then there are a couple of suggestions on, how do you incentivize action with results-based payments that we can get into another time, but thank you.
Yeah, thanks, Laura. While you're walking, we can go to Katrina right there, yeah. So Katrina, what did your group spend time talking about?
So we were talking about chemistry, and I guess some of the issues that are raised were how do we deal with these increasing complex threats and new emerging issues. So pesticides is one issue people were raising. We were talking about what do we do, what does the service provider do when you get a chemistry result? What are the options for them? Because a lot of people are working with these difficult chemistries, and then what are the spaces for low-cost tests? And so I guess if I can reflect on those briefly, some of the discussion we're having was around, we've certainly brought in low-cost tests for E. coli and field tests and different options on that side, and recognizing that the important part is getting the data really quickly, whereas chemistry, we see there's an opportunity to do that through accredited labs and build capacity for more testing nationally. With those, there is, at the moment, the focus is on arsenic and fluoride as the key international parameters, but recognizing that there's a longer list of WHO priorities as well, that will be expanded to over time. And so the idea being that, okay, if you don't find arsenic's a problem after that first time, we have that data now, right, let's choose something else for the next round. So pesticides being then on the further down list. I think one of the things to point out about the framework is that chemistry is not required to be addressed for that management incentive. So it's recognized that actions are not going to be necessarily in a gift of the service provider. It's not going to be something that's quick, but that getting that data collected and shared helps people to see this issue and to leverage other funding sources, leverage other options to help change the situation in the hopefully medium term or longer term.
Thanks very much. Let's go to Saskia over here. Saskia was talking about reporting to communities and authorities.
All right, so we didn't get very far beyond the question. And I think perhaps it's a bit of a reflection that the reporting part of this is some sort of the least defined, structured at this stage. So a lot of the questions were firstly around reporting to government, to authorities. What is the kind of readiness of authorities to receive that information in different contexts? There's a question about sort of the balance between data for operational use that's really useful at a local level versus data that's being kind of aggregated and integrated into more of a public health system and used more strategically. And then whether government is interested in data for hand pumps, if it's only serving a very small population per hand pump, and even for some of the pipe schemes that are serving quite small populations, a lot of the governments won't have a structure established to be receiving that data yet. So then there's a question of, how do you go about engaging? So we talked a bit about developing this rural water regulation space and how it is developing, but it's sort of an early stage development in many places. And then coming to the community reporting side of it, questions around how you do that responsibly to avoid the kind of maladaptive responses to data, and also, questions and concerns about the time that it takes to do community reporting well, to be actually explaining risk in a way that is understandable and also increasing trust in the service provider, demonstrating the value of the services rather than kind of undermining all of the good work that you're doing. So those are the key touch points.
Thank you.
So I will do attempt to actually read this out, but I think what I can see is my name. And then I'm going to take his name. So I'm gonna hand it over to him because I can't really see.
We talked about this yesterday.
That's a nice one, setting me up. Okay, so for our group, the conversation was around assessment and managing microeconomic risk. Very vibrant discussions. There were suggestions, there were questions around how they will ensure, based on what we heard. It looks like water quality is quite dynamic. It's an evolving area that changes quite rapidly. And in a bid to address that, is there a means of being able to increase the frequency of being able to test the water quality? And there were suggestions around being able to deploy very portable test kits and low cost test kits that are developed. And so we could explore the possibility of deploying this on site, on the field, so that service providers are able to equip their front level staff to be able to test water quality a bit more frequently. And then there were questions around how to manage the microbiological risk, especially at the point of use and the health. So we are looking at it at the point of production and also at the point of use, and whether we can design systems in a way that ensures that we do not only focus on the point where people are fetching the water, but also the point where they are using the water service at the household level. We also look at the possibility of service providers being, first of all, aware of whatever the water quality test results are, being able to interpret and analyze it, and also being able to adequately communicate it to government, being the service authority, so they are able to act on the results, be able to demand improved services or demand improved quality. I think that was also an issue that came up for discussion. And then the last but not the least, we wanted to look at how service providers can attract or can be incentivized through the payments to do a lot more of the testing. So it's not just about being able to provide incentives, but being able to link that to the frequency of the testing and how the results are being used to improve the service operations. And I think in all, there were 3 key recommendations: being able to leverage emerging technologies around the test kits, being able to encourage more frequent testing, and then also, as I said, encouraging more testing both at the source of production and then also at the point of use. I think overall these are the session that we mind and intimacy areas. There's something you want to add? Yeah, good job.
Thank you, Joe. The last, Megan's group is talking about regulation and standards.
Yeah, so I'll go ahead and kind of do kind of the themes that we touched on. We had a lot of questions and a lot of really good kind of opportunities to really make suggestions and recommendations for. I think the first thing that came up, which I can kind of respond to, and Andrea can also give you the opportunity to respond to it, but it does this framework encourage service providers to provide false results, so to falsify reporting. And I don't know if you want to respond to that directly, Andrew, or if you want me to, I'm happy to jump in and share what I shared with the group.
You go ahead and share.
Yeah, so I just pretty different data auditing requirements and reporting requirements, as well as QA and UC requirements built into both this framework and your other frameworks. So I think if you want to dive really deeply into those, they're available in the working papers that Andrew mentioned. Andrew can also hop in and share more after the session. Fair?
Yep, that's great.
Great. So besides that, we also discussed at length kind of QA QC, especially around microbial testing and how that can be built in either by national laboratories or in-house testing, and how that can be required in order to verify the results that service providers are reporting. We also we talked at length as well about kind of national regulatory requirements and how for some countries the service providers are working on, they may be less than what Uptime is requiring, and in some they may be more than what Uptime is requiring. So kind of trying to find a way to rectify those two things, but also using this framework as an opportunity to kind of encourage local governments to bring their requirements up to a higher international standard, like the one that Uptime is requiring. But then also vice versa, how do you rectify it? The local government is requiring much more than what Uptime is requiring. How do those pieces be put together? And then finally, what we talked a little bit about, what kind of payments are required in order to bring service providers to this level of service. And Andrew noted at the beginning, but that's something that Uptime is currently reflecting from their service providers to determine what those costs are. So, we'll see it there.
Great, thank you, Megan. Catherine, could I get you to bring the microphone up to the front? And I'm gonna ask Katrina to respond to the questions around sort of how does this, encourage compliance or with regulation. We've thought a lot about this. How does this approach, some countries' regulations are really like moonshot, and you can't really, it's gonna be really difficult to achieve the water quality regulatory guidance. And in other countries, there's like no guidance at all. And so we thought about that, and I'd look for Katrina to share. And Saskia, I'm also going to give you an opportunity if you have any other thoughts after Katrina shares some of this.
Yeah, so I think this is something we have thought about very much in developing this process, and looked at different countries' regulations and tried to understand the different perspectives that providers have to work with. But with Uptime and with this framework, we're not the regulator. So we're not aligning, it's an international approach, we're not aligned to an individual national standard, but more trying to look at how we, as we said, incentivize water safety more broadly. And so we recognize that some providers are doing, we've heard, the amazing work the providers are doing. There's some are already doing more than what we're requiring them to evidence. And that, but the hope is that the payments will help them in that process and help them still to expand further what they're doing in terms of water safety. I'm trying to think of any other key points.
I can't think of it. That was an important one that I wanted you to speak to.
Yeah, it's all written here, but it has been interesting looking at the different national guidelines and trying to find them firstly, and then seeing, because very often what we find is the national guidelines are designed for urban utilities with lots of money and lots more testing capacity, whereas for the rural systems, it's either unclear what regulations are for them, or they're inappropriate for what you might expect for those small systems. And so trying to look at how do we improve this over time, rather than to meet that arbitrary requirement or meet that requirement for urban utilities.
Thanks very much.
And if I can just say one other thing, I think just to highlight with these providers and with our work with Safe Penny is the affordability of it. While we're looking, we know there are going to be costs. There are costs associated with this, of course there are, and there are, there are potentially some large costs at times with different types of systems. But what we've been able to do with Safe Penny, what we've seen with some other examples, is that this is affordable. We can achieve this. That rural communities need subsidies, just like urban communities do. And this provides us with a framework for providing those subsidies for safe water.
And the hope, I think, is that service providers who have been very focused on market viability and bottom line, who have had to make difficult decisions to not invest in water safety because they're not being regulated to do that, that this source of funding might enable them to do more than they have been doing. Saskia, please, closing comments.
Closing comments. I think what I want to say first of all is thank you for all of the engagement. It's really great to get your feedback on this, and I want to emphasize that it is a work in progress. So we got into the beginning of some really interesting discussions, but we time limited now. I think we'd all love to hear more from you. If you have more to say, if you have suggestions, strengths, weaknesses that we didn't get to, please find a way to get those to us. And then I also just wanted to reflect, I think the first time I came to this UNC conference was 2017, and I had a poster about water quality monitoring in rural areas. And I had a lot of, this is never going to go anywhere. We can't act on this data. It's not useful. So just personally reflecting on how far we've we've all come in this. It's exciting. So I'm really looking forward to seeing the pilot and more of the learning that comes out in the next year on this as well.
Great, thank you. Yeah, so just a couple of closing points for me. Thanks to UNC for giving us this time to have this side event. If you have more questions or comments, my email address is there, and I'm happy to be the point. I can connect you to Katrina and Dr. as it needs to happen. But we've mentioned several times that we are piloting this approach. So this feedback that you've given us here is going to give us food for thought as we continue to pick holes in this approach. And you see kind of the timeline. At the end of this year, we're applying the approach in these 4 service provider contexts. Starting Q1 and Q2 of next year, we're actually going to issue payments based on water safety to these service providers, see how that works, and see where it doesn't work. Then hopefully by this conference time next year, we will have an update. I'm not going to commit to having a working paper by this conference, but we will have an update. So come to this conference and look for us again next year and see how this is actually applied. And yeah, that's all I have to share. So, thanks very much.
All right.